Law enforcement officers are dedicated. Every day they put on a uniform and deal with everything from pesky kids on skateboards to bank heists. And while officers always strive to do their best, sometimes they encounter situations more suited for social workers, like dealing with mental health crisis calls, which is why we have crisis intervention teams. CIT programs teach law enforcement officers how to safely de-escalate mental health crisis situations. In fact, law enforcement agencies that have CIT programs in place have reported as much as an 80% decrease in officer injuries during mental health crisis situations. Not only do CIT programs educate officers, they also bring together community members and mental health care providers to offer convenient options for treatment and to reduce the number of repeated calls for police service, saving officers valuable time. Take the next step in helping your community better respond to mental health crisis calls. Learn more about CIT programs by visiting NAMI.org/CIT.
Welcome to My Healthy Mind. I'm Michael Hunter. Today, I'm happy to be bringing you some good news about a program in Detroit that's changing the way law enforcement thinks about mental health and crime. Here to talk with us about it is James White, Assistant Chief of the Detroit Police Department, who explains how crisis intervention training is showing hopeful signs of diffusing tensions on both sides of law enforcement. Chief White, welcome to My Healthy Mind.
Thank you for having me.
Many people watching will be unfamiliar with what CIT or crisis intervention training is. Can you give us a brief history about it?
Yes, CIT is a training component that we adopted several years ago, originally out of Memphis, Tennessee. And the idea is to provide officers with tools that they could use when they're engaged with the mental health community, and certainly those that are in crisis in the mental health community. You know, we engage in a number of mental crisis runs on a daily basis, on an absolutely daily basis. So the officers are using the training, and those officers who have not received the training thus far are able to call officers who are trained. And when those officers are working or even in phone contact, they're able to assist them in the situation that they're dealing with.
And what kind of responses or results, more so, are we seeing in those precincts where CIT is up and running?
So some of the data that we've seen thus far suggests that the encounters, though much longer as it relates to the time involved in handling the run, they are less violent. There's less injury to not only the officer, but more importantly, as importantly, the citizen. It just involves a lot of conversation, a lot of listening, and a lot of de-escalation. And so the biggest benefit, I think, with the training is the minimization of the injuries, minimizing injuries to officers and citizens, de-escalation, which is a huge piece of this training, and then assuring the citizen that's in crisis that we are here to help. At the lower level crimes, the disorderly conducts, someone who is creating a disturbance, if we're able to tie bar that to a mental health crisis, then we're able to get them the services that they need as opposed to jail time.
And Chief, what were some of the catalysts that brought about this change to introduce CIT?
We saw a number of people coming into our system, coming into the DDC, which is our detention area, that were in mental health crisis. And we recognized that we had to do something different. A lot of these people didn't belong in jail. So what could we have done, or what could we do to help our community? And we found that, you know what, if we could have caught it on the front end, if there's something that we could have done, if we could have connected them with services, perhaps they wouldn't be in the jail system. Constantly responding to the same runs over and over again, disorderly conduct, people walking in traffic, that type of thing. And these people were becoming really victims of their disease, being arrested, getting a criminal record, where I think it would have been more appropriate if we had the tools then to put them in a track where they could have gotten the appropriate services that they needed.
The one thing I've constantly said, and it's not just unique to Detroit, but the system is severely broken, and it's broken because when you look at the Wayne County Jail's example, I've had conversations with my colleague and friend, Sheriff Benny Napoleon, who would tell you on any given day he's housing anywhere between 60 to 70% jail population of individuals suffering from mental illness. And really, if you think about the problem, these are individuals that committed crimes because of their mental illness, who didn't receive the appropriate treatment. And so when are we going to fix that system? I mean, if we could fix that, it would certainly reduce violence in our city.
And who was instrumental in bringing the program to Detroit in particular?
Well, certainly it starts at the top. The chief in 2013 looked at the data when we were doing our initial review of the entire department upon his arrival. One of the things that really showed itself from a data perspective was the volume of runs that had a nexus to mental crisis. And so he asked me and tasked our team with looking at what are some of the best practices around the country. We enjoy a very good relationship with our partners, our community partners, Wayne County Mental Health Authority, and several others, Northeast Guidance Center, and we were able to come in with a number of different training programs. One of the most positive things that come from the training is just the overall decline on having to use force in these encounters, and that's fantastic. And like I said, it's fantastic for the citizens, and it's fantastic for the officers. So when the officers are there, they're able to engage, communicate, and at the very basic form, the entry level component to this training is to introduce yourself. As simple as that is, that's something that we didn't do prior. There was an assumption that as a police officer that there's an understanding that I'm the police. Well, when someone's in crisis, that might not necessarily be the case.
Your background is broader than just law enforcement. Can you tell us a little bit about that and how it fits into training?
Yes. Well, my formal education is sociology undergrad from Wayne State University, and I also have a master's from Central Michigan University in mental health. And I'm a licensed mental health counselor.
Has that helped you in getting buy-in from the other officers for the training?
When we looked at this training and we looked at the impact, and when you're able to show statistically, less injuries to officers, less injuries to citizens, less citizens complaints, and most importantly, members of our community getting the services that they need and not being charged with a crime because they're suffering from mental illness, that causes the buy-in. And from a personal standpoint, I don't know if, I know there's mental health crisis in my family, and I'm having a hard time now lately finding anyone who is not dealing with some form of mental health crisis in their family. So the buy-in is not just, us and them, it's we. And when you can say to people, hey, here's how we can help our community, and they can identify in their own living room oftentimes that these are people that will be receiving this help, the buy-in is relatively easy.
And when that buy-in occurs and the officer is going to participate in the training, is there also a benefit to that officer?
Oh, absolutely. And so the way we structured the training is we ask for volunteers. So that's going to get you your most impassioned people on the subject matter. And then those people, after they're trained, will serve as ambassadors for the program for those who may not understand or may not know. So before we mandate the training, and it's going to be mandated, but we want to certainly make sure that our base level training and trainers are people who are passionate about the work, who understand the work, and can demonstrate the success of the work, whether it be through data or just in stories or communication. And then we also use those officers to be our trainers.
Stress, depression, and severe mental illness can happen to anyone. Team Wellness Center has been helping those struggling with these conditions in southeastern Michigan.
They get a chance to know that somebody's on their team.
We think nobody else feels the pain that we feel. We feel like I'm the only one, but that is so untrue.
Within 24 hours of reaching out to our team, members receive psychiatric evaluations and begin the necessary treatment for recovery.
working through my problems and seeing that I'm not the only one that has to cope has really brought me to a place where now it's okay to talk about it.
Because if you keep stuff to yourself, you can't overcome. We all need one another.
Team Wellness Center. You are not alone.
My name is Marcus Harris II. I'm a police officer with Detroit Police Department. I grew up in the city of Detroit, which is on the west side of Detroit. I know the youth, I know the community as well. I have a background in mental health first aid, which I took while I was in the academy with the Detroit Police Department. I was selected for this program because I do have a good relationship with the community. It is a pilot program. The program is for a whole week. With CIT program, you have to be able to de-escalate the situation when you're dealing with a person with a mental crisis. A person can be at a 10 and your job is able to bring them down back to a 1. Be mindful, a person that's in mental crisis at that moment, they don't understand what's going on. Their brain is triggering a lot of things at that moment, and if you're not a patient officer dealing with someone in mental crisis, the situation can escalate. I don't want anything to happen to you while you're in this state of mind. I want to be able to help you and your family to provide you with the right resources and be able to provide you with the doctor or a social worker that you can talk to get the help that you need. This program is an international standard and I am proud to be part of it.
Oftentimes, without this type of training and other training in mental health and law enforcement, you don't know what you're looking at. When you've got somebody who's bipolar, who's manic, or who is suffering from varying forms of schizophrenia, they may look extremely hostile, paranoid, aggressive. And if officers don't have that training and you only have one tool in your toolbox, then that's the tool you're going to use. But when you expand your toolbox and you expand your training and you've got a CIT component or other mental health support training, you're able to identify someone in crisis and really address the situation very differently. And when you talk about re-victimizing them, they are a victim of mental illness already, something that they did not ask for. And now they're being put into a system that's not designed to treat mental illness.
Can you talk a little bit about the techniques or structure of the program and how long it is, the training?
40-hour training, and as I indicated at the very basic level, it's really 4 components to it. One is basically to introduce yourself. I know I keep saying that, but you really don't know how important that is for what we've seen, how that one piece de-escalates a lot of situations. Because when people don't know and they're in crisis and they see a police officer, the first thing that they think is, I'm about to either get hurt, get shot, or go to jail. And when an officer says to a citizen, good morning, I'm Officer White, I'm here to help, that has a incredible impact on the circumstances. And then another piece of it that I love is the de-escalation piece. And the de-escalation starts with the introduction, but it's not back and forth conflict. It's officer presence, it's introduction, it's de-escalation, and then it's making it safe for the citizen. Understanding that the citizen is made aware of the intended outcome of the engagement. So if that intended outcome is, I'm going to get you some help, that intended outcome could be, I'm going to call in a doctor because I see that you're injured. I'm going to call in EMS, or if it's unfortunately you've got to go to jail, because I'm going to have to put handcuffs on you. It's constant communication. So that's really the crux of the training.
And you also mentioned being able to develop the skill set anyway to be a good listener, an active listener.
Absolutely. You have to listen. And we don't one of the things with CIT that's super important for our officers is that they've got the time to talk to the citizen. So prior to this type of training, officers have to respond to police runs. You get to a police run, you have to resolve the police run in a relatively reasonable amount of time to get on to the next police run. When you're CIT trained, that is your run. That's it. Okay, it stops when it's over. There's no clock. There's you have to talk, but you also have to listen, and you have to listen twice as much as you talk. So when the citizen is talking to you, your job is to listen to the citizen, engage the citizen, actively listen to the citizen, and that allows for that de-escalation to happen. And what we've seen and what we're very excited about when we look back at some of the video, or we talk to the officers that have had the training or had the engagement, they talk about how the citizen, once the trust is built, is willing to walk to the police car with them, is willing to walk to the EMS vehicle with them. And the officers then, after the episode is over, they get the assistance that they need. Then there's follow-up with them, which is also very, very positive. They give them resources. And we've got a number of officers that'll go back and check on the citizen and ask, is there anything that you need? How are things going? There's actually a very large segment of the training focusing on empathy and how to show empathy. Police officers historically can be somewhat rigid in our delivery. The old days of, just the facts, ma'am, or just the facts, sir, are over. I'm showing our age here. It's more about communication, and it's a people business. Policing is a people business, and we're people. So there is no us against them. There is no we and them. It's us. And so I wear this, okay, but I take this off. This is a suit. This is a uniform. But it's about the people, engaging people, getting to the core of what people need, not necessarily me as an authority figure coming in and asserting my power onto you, but to empathize with where you are and what you need. And when you look at some of the runs that we have, whether it be a person who's making a poor decision to use a gun to resolve a very simple conflict. You stepped on my shoe, you bumped into me. They didn't have mushrooms, so I shot the restaurant up, and that happened. You could argue that these are all representations of untreated mental illness, because that decision-making metric doesn't line up. That's not how you resolve an issue. That's the core deliverable that we're looking for from our officers, is to engage at a level and empathize at a level where you see yourself in the person that you're talking to. There was an incident out of the 4th Precinct where a gentleman was in crisis, had a knife, and wanted to commit suicide. And he was screaming and crying, and the officer spent an hour talking to him, maybe even longer. And he wanted his wife brought to the scene. The officer got his wife to the scene. He wanted a cigarette. He wanted the officer to have a cigarette with him. And we have a policy against lighting cigarettes and things like that, but the officer provided him with a cigarette. The officer took time to give him everything he needed. He continued to hold the knife, going from his neck to his throat. He actually, if I'm not mistaken, had, when the officer initially got there, a person that he was holding the knife on, and the officer was able to get that person out of the scene, and then he just turned the knife on himself. Fast forward throughout the story, officer spends a significant amount of time talking to him, de-escalating the situation, and they were able to get him in the custody without injury to himself or anyone else. And I thought that was a fantastic depiction of, if this is done right, how it could look.
It's certainly something that's critically important to this department. We know it saves lives. It certainly reduces injuries on our officers, fewer uses of force, and certainly when you talk about injuries to those who are suffering from mental illness. Our officers truly care, and they understand that when a person is suffering from mental illness, the goal is to get them help.
I'm privileged and blessed to work in an agency with progressive leadership under my chief, Chief Craig. We've got fantastic officers that are out there every day and night dealing with some really difficult situations and doing so masterfully with the highest level of integrity. But we have to do a better job of really providing officers around this country, not just in Detroit, with the tools that they need to deal with the circumstances that they're dealing with. And one of those tools is mental health training. I think it's imperative that every officer in the United States receives mental health training, whether it be CIT or another equally reputable training segment. One of the things that the officers report is some of the training that they've received, they've actually used it in their personal life. They've used it, in just alleviating conflict in their personal life. So having a well-trained police department has far-reaching benefits.
Do you anticipate that we will be able to improve our mental health for our officers as well and tear down some of the stigmas associated with treatment for mental illness, even if you're a police officer?
Absolutely. So my specialty is PTSD, and my focus has been first responders. And when you look at the violence that our officers are seeing on a day in and day out basis, you cannot ask them to go into situations day in and day out. We watch these scenes play out on the news, and we watch these horrific crime scenes, or 2 people shot, 3 people shot. We look at these fires where children are killed in fires, rollover accidents, drunk drivers, and then the more traditional police runs, the domestic violence and things like that. We never really ask ourselves about the officers who responded and had to see it. We don't ask ourselves about the EMS first responder that had to transport that injured child to the hospital, or make that death declaration at that scene of that 6-year-old, that 7-year-old. We don't think about them. Well, compound 25 years of seeing that once a week, seeing a shooting, an accident. It has an impact. It has a direct impact, and it's very similar to the impact that we see when soldiers return from war. When you see that type of death and violence and that unpredictable environment. And so we have destigmatized in our police department mental health support for our officers. And we're constantly talking to them and trying to provide them resources. I know I'm bragging about my boss, but he brought a program here from LA called Peer Support, something that we never had. And from that moment forward, we've had officers who have gone to those types of runs, been involved in shootings, been involved in critical incident debriefings, talking to our officers and supporting them and helping them through the crisis that they've seen. And so by doing that, officers are a little more free to talk about their feelings. When I first came on, you didn't get a chance to do that. You go to a crime scene and you had to be tough. You got to get ready for the next crime scene. You couldn't stand around and show any emotion towards it. We encourage that now. We encourage that emotion. We encourage you to talk about your feelings. We encourage you to seek the help that you need. And we don't penalize you for it. We don't penalize you because it's tough. You can't go to work tomorrow. And the biggest takeaway from that is how we engage our community. Because if you keep robotically asking these officers to keep giving and giving and giving and not giving them anything, that's going to impact your community. You're going to have one-dimensional officers engaging citizens in a robotic way that will have a negative impact on your police department.
Chief, we've talked about mental health from the victim not being re-victimized, the community, and the officer. What would be your final thought to give to our audience about mental health and law enforcement?
Well, first and foremost, we're in this together. It's all of us. And I said it earlier, it's not them and us, it's us, it's we. We're all dealing with it at some level, whether it be at an enforcement level, where we're going out and handling the police runs, whether it be in our personal lives, where we have family members that are battling anything from bipolar disorder to depression, anxiety disorders, or whether it be the law enforcement officer who is suffering from PTSD. We're all in this together. It's no need to move from this with embarrassment. We need to destigmatize mental health in this country and talk about it openly, which is why I'm so excited to be here today.
At Team Wellness Primary Care Center, you will find all the basic services you need to be well and stay well. Come in for all your screenings. Come in for routine physicals and checkups. Come in for full-service dentistry. Come in for vaccinations and immunizations. At Team Wellness Primary Care Center, we take care of your total health. Team Wellness Primary Care Center. Come on in. At Team Wellness Dental Clinics, you'll find plenty to smile about. Our friendly professional dentists and hygienists are here to give you the full range of preventative and remedial care you need for a beautiful, lasting smile. From diagnostics to routine cleanings, our team does it all, right in your neighborhood. So whether you come to us or we come to you, you'll get the kind of dental care you need to keep smiling. Team Wellness Dental Clinics, now serving communities all over Metro Detroit.
Thank you for joining us today as we learned about the role crisis intervention training is playing and will continue to play in identifying mental illness to help diffuse tensions on both sides of law enforcement. If you'd like to learn more about this or any mental health issue, please visit our website at myhealthymind.com, on Facebook at myhealthymind, or on Twitter. We'll see you next week for another edition of My Healthy Mind. Let's talk about it. Don't forget to like, share, comment, and subscribe for more content from My Healthy Mind. Let's talk about it.
Hi, I'm Anthony, owner of the Policella Insurance Agency. Thanks for stopping by. I'm going to tell you a little bit about the insurances and services we offer. For individuals and families, we offer health, life, dental, vision, and disability insurance from multiple carriers. We even offer health insurance plans from healthcare.gov and Medicare plans for those over 65. Do you own a business? If so, we offer a variety of employee benefits like health, dental, and vision coverage for businesses with as few as 1 employee or as large as 500. We also offer commercial coverage like general liability, workers' comp, and property insurance. The Policella Insurance Agency is an independent agency offering multiple insurance carriers, which means you do not have to call around to several different companies shopping for coverage or rates. We will give you quotes from different carriers to help you find the best price and coverage for your family or business. If you have questions about insurance for you, your family, or business, call us today for a free quote at 1-800-578-5141. Thanks for stopping by.